that hospitals are now dealing with.
To find out what's going on, we want to talk to Kevan Metcalfe, Chief Executive of Memorial Hospital in Gardena. Kevan, thanks for being with us.
Thank you.
Question, let's just start with your hospital. What are you seeing there?
Well, we're having a crisis. We've had 3 surges since the pandemic started. Currently, we are seeing 3 times the level we saw the first time. My hospital is full. I've got 25 patients in the emergency room with another 14 to be admitted. And probably I wish I was at zero at ICU. I've got 10-bed ICU with almost 30 patients in the intensive care unit, which has caused us to expand our care outside of the intensive care unit. That in and of itself has created a severe staffing crisis in getting nurses to even be able to care for those patients.
So what do? We keep hearing this phrase of rationing care. Is that where you're at?
Well, certainly the ticket to get into a hospital now is you have to be very sick. There's no doubt about that. And I would call that rationing care, because some people who present to the hospital that we normally would admit in the past, we basically have to tell them they're going to need to go home because we don't have beds for them, and follow up with maybe their physician in their office if they're able to do that.
How concerned are you about a surge upon a surge upon a surge as we get past this holiday season?
We are very, very concerned. I had 1 COVID-19 patient in my hospital on November 1st. I have 79 today. My hospital will be 100% COVID-19 patients, I predict, by the end of the week. So we've had to expand our care outside of the traditional areas. I've suspended my surgeries, and I've taken over the preoperative area. I've taken over the recovery room to care for the expanded ICU patients. And we are staging our auditorium to fit another 15 patients into that particular area. But we need the staff, and that's the appeal that I have for the healthcare system, is we need nurses desperately in Southern California right now.
Yeah, and the governor has talked about this idea of like a health corps to try to bring in some people that may be retired and other people to try to sign up as well. Okay, there are still people that are not listening to this, that say that this thing is a hoax, that don't wear masks, that defy the rules, that gather in large groups, that go to parties. It's still happening. What do you say to those people? Because clearly the public health messaging has not gotten through to those people. What do you say to them?
Hundreds of patients are dying. The first surge was the elderly through the nursing homes. But from then on, it's really encompassing most ages. Our average age now with this virus is probably 50. So we're seeing a significant amount of 40 to 65-year-old patients right now. This is not happening in the elderly at the rate today that it did back in March. So all I would say is this disease is not going to affect a lot of people, but it's going to affect some people, and people are dying from this. The only way I'm getting empty beds right now is people die from the disease, and that's very sad and very scary. If that doesn't do it, I don't know what else would.
Well, Kevan Metcalfe of Memorial Hospital Gardena, I feel your passion and your reality there. We thank you so much for that really gripping perspective.
Yeah, and please thank your staff for all the hard work that they do every day as well. They're the real heroes in this, and thank you.
Appreciate it. Thank you for getting the story out.
Yes, thanks for your time.
Wow.
That was... I mean, we've done a lot of interviews. I don't know, I just really felt that one.
Well, and the situation has clearly gotten so much worse, and there is so much BS hyperbole that's